Hi, thank you so much for joining us, the board of the Special Olympics. I'm Lacy Borkson.
I'm Alex Safra.
I'm Amy Pinder.
And I'm Paige Krupa.
Okay, so first we're going to look over an overview. So the current situation is that local Special Olympics like yourself currently do not have access to occupational therapy services. And without OT, athletes may not receive support for improving functional abilities such as motor coordination and balance, injury prevention, or social interaction skills, which can limit their full potential. So, as an opportunity by integrating OT services, athletes can improve performance, quality of life, and overall participation in Special Olympics events. So, our goal is to provide OT support to enhance athletes' abilities, benefiting both individual athletes and the overall Special Olympics community. Our long-term vision is that if successful, this initiative could serve as a model for other Special Olympics regions, promoting the expansion of OT services in disability sports nationwide.
Key issues include the lack of established policies that recognize the role of OT in the Special Olympics, and it limits access to OT services for athletes. Some reimbursement policies often do not cover OT services in recreational sports. So without these policy changes, athletes could miss out on beneficial OT services that can enhance their overall social, emotional, physical, and cognitive abilities. Petitions and public awareness campaigns through the role of advocacy can raise awareness of the need for OT in adaptive sports, and the change to the current legislation is very needed to update state practice acts to ensure there are not restrictions on OT's scope of practice.
So looking at some contextual factors, we have the social context, such as community perception. So social attitudes towards individuals with disabilities can impact the acceptance of OT in the Special Olympics. So educating the community on the value of OT for improving performance beyond rehabilitation can foster acceptance. We also have the support from families, and families may need guidance on how OT can benefit their child's performance and well-being, which will be key for gaining support. We also have the economic context with funding and resources. So budget constraints may limit the ability to offer OT services. So cost-effective solutions like collaborations with local universities or using volunteer OT students can help. We then have some more contextual factors such as legal and policy contexts, such as disability rights. So acts like the ADA support access to services for individuals with disabilities, and OT plays a key role in ensuring these rights are met in sports programs. We also have the Special Olympics policy, so understanding and aligning OT services with your policies on athlete eligibility and participation is going to be essential. Then we have the organizational context with support from key stakeholders. So support from Special Olympics leaderships, coaches, and the board is critical to integrating OT services successfully. And we also have collaboration with professionals. So building an interdisciplinary team with OTs, physical therapists, coaches, and more ensures a comprehensive approach that best meets the athlete's needs.
So, some socioeconomic factors that influence the provision of OT services would be limited access due to costs. So, many families cannot afford private OT services, which leaves athletes without essential support. Financial barriers to adaptive sports. So, specialized equipment for adaptive sports, such as wheelchairs and orthotics, are expensive and are not always covered by insurance. And then there are transportation challenges. So athletes in low-income areas may have difficulty accessing OT services due to the lack of public transportation options. So some proposed solutions, there can be university partnerships, so partnering with OT graduate programs, grant funding and sponsorships, applying for state disability funding to offset therapy costs for Special Olympics participants, and collaborating with local hospitals or rehabilitation clinics to secure sponsorships. And then on-site therapy, so implementing mobile OT services at training sites to increase accessibility and reduce transportation barriers. And then some political factors. So there's limited policy awareness. So policymakers may not fully understand how OT enhances Special Olympics participation. And there's also funding challenges. So Special Olympics receives funding for sports programs, but not for therapeutic services such as OT. And without state and federal recognition, OT services are not prioritized in budget allocations. And there's a need for legislative change. OT is often recognized in schools and hospitals, but not in recreational and sports settings, which makes it more difficult to obtain funding. And for some advocacy recommendations in this area, encouraging legislative engagement, working with state representatives to propose OT funding for adaptive sports programs, advocating for changes in Medicaid policies to cover OT services in non-medical settings, and community mobilization. So organizing public awareness, events to educate lawmakers and community leaders about OT's role in the Special Olympics, and also collaborating with national organizations such as AOTA, partnering with Special Olympics USA to create policy proposals supporting OT in disability sports.
Now, looking at the demographic factors, there is a growing need for OT and adaptive sports. So, the increasing prevalence of developmental disabilities such as autism spectrum disorder and Down syndrome raises the overall demand for OT services in sports. There are also aging athletes that require more support. So, many older Special Olympics athletes face mobility challenges and need OT to maintain their function and prevent further injuries. There are also cultural barriers to therapy, so some families may not recognize OT as a valuable service for sports training, and there could be language barriers that can limit communication between OTs and families. So the proposed solutions for these demographic factors are having culturally competent OT services, offering multilingual resources and outreach programs to increase the awareness of OT benefits. We can expand OT services to older athletes to create adaptive fitness programs. This can help the aging athletes maintain their mobility and their independence. And then lastly, promoting inclusion across diverse communities. So working with local disability advocacy groups to expand access to OT in these diverse communities can help overall.
When looking at the level of advocacy, this would be the local impact. So our proposal would begin with your specific South Florida region Special Olympics program. However, the goal is for this initiative to grow and be a model for other regions. So when looking at individuals, we look at the individual athletes and we look at improving their performance, quality of life, and overall participation in Special Olympics events. For groups, we look at the Special Olympics as a group, which, should the collaboration prove successful, this initiative could serve as a model for other Special Olympics programs across the country. And then population-wide, we look at all disability sports programs. So this initiative could influence broader policies promoting OT integration into disability sports programs nationwide.
So, how OT can benefit the Special Olympics? So, we can foster collaboration between therapists, coaches, and healthcare professionals to optimize athlete participation and well being. We could provide expertise in adaptive strategies and accessibility to enhance inclusivity in sports programs. We can also offer training and education to coaches and staff on sensory regulation, motor skill development, and behavior management. We can also assist in developing injury prevention programs and safe training protocols for athletes. And we can also support long-term athlete engagement by designing transition plans that encourage continued participation in sports and other meaningful activities.
So we just discussed the benefits to the organization, so now we're going to discuss the benefits to the participants. So first is the holistic athlete care. So we support fine motor coordination, sensory processing, balance, endurance, and social skills. Performance and injury prevention, we improve body awareness, focus, motor planning, and prevent injuries for sustained participation. For coping and time management, we develop stress management strategies and help balance training, school, and daily tasks. For social connected social connections and independence. We enhance communication, teamwork, and promote independence. For confidence and resilience, we build confidence and help athletes overcome challenges. And then for transition planning, we foster skill development and support long-term independence in sports and daily life. So the alignment with the Special Olympics mission is that the Special Olympics strives to provide a welcoming environment for athletes, promoting both physical and emotional development. OT aligns perfectly with this mission by offering therapeutic support that empowers athletes, helping them perform their best while enjoying the process.
So for evidence, I found a couple articles. So one was health outcomes of Special Olympic athletes as compared to non-athletes. So it found that OT enhances health and participation by helping Special Olympic athletes improve motor skills, coordination, and daily function. OT can also improve access to health services by facilitating screenings and ensuring athletes receive the necessary care. And OT supported adaptive sports and social inclusion by assessing needs, modifying equipment, and developing training programs. And additionally, it helped OTs build self-care, communication, and emotional regulation skills. So it helped with empowering them to fully engage in sports and social activities. Another one that we found is understanding self-determination as a crucial component in promoting the distinctive value of OT and post-secondary transition planning. So this really focused on highlighting the role of OT in promoting self-determination as a key factor in the Special Olympic participation. So this is by fostering decision-making, problem-solving, and goal setting. So OT will help athletes gain confidence, independence, and a sense of control over their activities. OT supports post-secondary transition planning for the Special Olympics athletes by developing skills that enhance participation in sports and daily life. And through structured interventions, OTs help athletes improve communication, social engagement, and adaptive skills, fostering long-term success in both competitive and community settings. And then the last one was promotion of health and fitness programming using an occupation-based approach. So this was a capstone project. So it demonstrated that OT enhances Special Olympics programs by promoting health, fitness, and participation through occupation-based intervention tailored by athletes with intellectual disabilities. So the OT strategies focused on injury prevention, ADL-based fitness activities, and increasing accessibility to adapted physical activities. And the capstone project showed that OT interventions improved athlete engagement, health literacy, and functional fitness within the Special Olympics North Carolina by integrating structured movement programs, digital resources, and peer-led initiatives to support long-term athlete well-being.
This is an advocacy tool that we created. It's called Unlocking Potential: How Occupational Therapy Supports Special Olympics Athletes. So this is a tool that you can use to print out and pass out and distribute information about how OT supports Special Olympics athletes. So we broke it down into 4 categories. So it looks at the challenge, which is the limited access to OT, the lack of funding, the policy barriers, and transportation challenges. This kind of just gives an overview of everything we discussed in this presentation and allows people to do their own research and use the hashtags we provided at the bottom so they can follow and spread the word about OT in Special Olympics. It looks at how OT helps. So it helps by improving motor skills and strength, preventing injuries and enhancing safety, developing those social and communication skills, and enhancing time management and independence. It gives a little brief overview of policy and funding. So there is no designated funding that exists for OT in Special Olympics programs. OT services are not formally recognized in the Special Olympics policy. And then lastly, state restrictions limit OT's ability to work in community sports programs. So looking at what needs to change, like we said, legislative action, funding expansion, and leadership engagement. So like I said, to hashtags OT for Special Olympics and Adaptive Sports OT promotes that engagement within the community.
And these are our references, and thank you for meeting with us. We hope we gained your support, and we hope you'll consider incorporating OT into your program.